Hi, everyone. Happy Sunday, and welcome back to another Sleephoria mini webinar. And we are live. So, today we're talking about sleep and hot flashes and how clinical hypnotherapy can make you feel better. If this sounds interesting, please keep watching. So, clinical hypnotherapy is actually a modality that I'm trained in. I'm trained through the American Society of Clinical Hypnosis, or ASH. Ash.net is their website if you want to learn more about it. But let's start off with what is hypnotherapy. And, please note I'm using the word hypnotherapy instead of hypnosis. Hypnosis has a lot of sort of controversy. If you think about it, when I talk to a lot of my patients about hypnotherapy, they start to think about like the movies and, someone holding a watch and then someone just like instantly falling asleep, or maybe if you've seen a show in Vegas, someone dancing on stage or clucking like a chicken. When you work with a physician, a healthcare provider, a lot of dentists can do clinical hypnotherapy. It's the word therapy. So we're using the power of the subconscious mind for a therapeutic benefit. And in my case, we use it to help improve typically insomnia. But I was asked recently about how can how can someone use hypnotherapy to improve their hot flashes as well? And it's really interesting because there were actually some randomized controlled trials about it, which I'll go into a little bit later. But let's first talk about what is a clinical hypnotherapy, or what is hypnosis. So, right. I'm going to use the word hypnotherapy instead of hypnosis because we are using it from a medical standpoint. And even though I'm a medical doctor, this video is just purely informational. So, when I use it in my practice, what I describe to the patient, I have an intake form. I basically, what we're looking at is helping someone relax to the point where they're in a highly focused state of attention. And so, one of the best ways I like to describe it is if you have young kids, this is a really, really easy concept to understand by going into trance. When my kids are watching TV, when they're watching YouTube, when they're really engrossed in a game or a book, it's hard to get their attention because they're laser focused on that one thing. I can say my daughter's name probably like 5 times before she's like, huh? Because she's so focused on what she's doing. This has happened to us as well. So imagine a time when you're going to the grocery store and um, let's say you're coming home from work and then you're going to go to the grocery store before you go home. But a song comes on the radio, or, your playlist, and it brings you back to a time maybe in college or in high school or maybe even your childhood, and you're so engrossed in listening to that song, and maybe you're singing along, and by the time the exit, if you're on the freeway, or the turn comes for you to go to the grocery store, you skip it, right? And you just end up back at home and you're like, oh wait, how did that happen? Because you were in a state of trance. You were so highly focused on that song that you weren't really paying attention to the details of the road, which can happen. Another way to think about trance is, imagine being with a really good friend that you haven't seen in a long time. And sometimes time can just go by in an instant. So you're having lunch with this friend. It's been like 2, 3 hours, and it feels like just half an hour has gone by. So when you're in this state of highly focused attention, awareness, we add post hypnotic suggestions, which I like to describe as positive psychology. And for a lot of my patients, what it sounds like is you're a great sleeper. The minute you put your head down in bed, you feel instantly relaxed. You feel your muscles relaxing. You feel an over sense of calm and relaxation coming over you. And you sense that this place is a place that you can sleep as long as you need to. And so, using those post hypnotic suggestions, really those positive cues around building their ego, building their confidence in their ability to sleep, and really giving them control over their arousal state, right? So, when we take a look at what sleep is, sleep happens when your brainwaves slow down. So, there's something that's keeping your brainwaves from slowing down. For a lot of people, it's the overactive mind. But for a woman who are going through menopause, perimenopause, and have a lot of hot flashes, right? That sudden sensation of that temperature rising. Sometimes it just feels like in an instant, and now you're drenched, and it can really wake you up from sleep. So, how can we use clinical hypnotherapy for that? Well, It's really fascinating. There actually was a couple studies where they compared in randomized control trial gabapentin, which is medication that has been used to treat hot flashes, compared to clinical hypnotherapy in folks with breast cancer. And the sessions were actually only 3 1-hour sessions, which doesn't seem like very long when you take a look at, I think, teaching someone a behavior change, which is like really helpful because if you can think of, I can control my hot flashes after 3 hours of learning it, why not? I think it's a good option. Well, I practice it, so I'm definitely a fan of it. And so, in the first session, in the group who did do the clinical hypnotherapy, they learned that they can actually control their symptoms through the unconscious mind. And I think that's something that's so powerful is that teaching someone to realize or just understand the power of their brain, how neuroscience works, how the neurons can fire, and that we can actually control our subconscious mind when we're awake, right? Using the conscious mind to control the subconscious mind. So that was the first lesson. And then the second and third lesson, the women were taught how to just really think and invoke images of cooling. So, like, for instance, imagine yourself standing in the North Pole. Maybe you're in an igloo or you're, you're playing in the snow and you're doing making an angel, or and then you can see the coolness of your breath, you're feeling the ice just melting away the hot flash. Or another one is maybe like stand imagine you're standing underneath a really cool waterfall, and as you're standing there and maybe you can sense the hot flash starting to come, just the coolness of the water drips down from your head and really covers your body, washing away any warmth or sensations and allowing you to feel cool and calm. And so it's really just using the power of your brain through really vivid imagery to help cool your body down if you're going to use it for hot flashes. And then what really works, and this is what I do in my practice as well, is that we typically record the session. There are things that you can find online, I'm sure on YouTube, or guided imagery recordings, and you can listen to it. And this is the part that retrains the brain. Whatever you practice grows stronger. So the more you practice listening and listening and listening to the clinical hypnotherapy session that was created for you or a guided imagery session, it really is helpful. And so this particular study, and it was a small study. The women who took gabapentin showed a 30% reduction in their hot flashes versus the other group who learned about hypnotherapy for about 3 hours had an 80% reduction in their hot flashes, which is really phenomenal. I'm a fan of the 80% group. I mean, it's not for everybody. Sometimes people do have a hard time getting into that state, but I always say, just like when you go to the gym, just when you're learning a new skill, it certainly does take practice. And gabapentin does have some side effects, so it's always something to caution someone about. There was another study that looked at hot flashes and hypnotherapy versus, it wasn't a drug trial, it was just basically learning about hypnotherapy versus having someone pay attention to their symptoms. And this study was about for 5 weeks. And the ones who did clinical hypnotherapy did really, really great. The frequency of their hot flashes decreased by 70%, even up to 80% in some, versus just learning to pay attention to your symptoms only decreased by 17%. And the cool part about this study is they also had a secondary measure where they asked them about their sleep. And they also reported better sleep that was statistically significant, which makes sense, right? If you're having hot flashes at night that wake you up, and now those hot flashes are reduced, then the quality of your sleep is going to be better. What does the research show about insomnia and hypnotherapy? And it's almost a little bit, I don't want to say depressing, but it wasn't too helpful because there aren't a lot of studies. And one study they have pulled up here, it's in the complementary therapies in medicine. It's the title is Hypnotherapy, Insomnia, Narrative Review of the Literature, done pretty recently, May 2022. Basically, there are some studies, but the studies weren't designed really well. They didn't have any statistical significant results. And basically, we have to design better studies to show an improvement. But what I can tell you anecdotally, I've had a lot of patients who come to me for clinical hypnotherapy, and it does, in fact, work because you can train your mind how to reduce that stress response. And that's what a lot of the times happens and keeps us from falling asleep, whether the trigger be a hot flash, whether it be anxiety, or whether it be just our mind is racing, or we just have so much going on in our life. I've even done clinical hypnotherapy in folks who have some pain. And when you can help someone get into that relaxation state, right? When you can teach them how to be calm. I do clinical hypnotherapy myself sometimes when I can't sleep. And I find myself, the more I do it, the easier it gets to become into fall asleep faster because I'm able to calm myself down even faster. If you are looking for someone who can help you either with your sleep or hot flashes or pain or any type of symptom, and you're not a big fan of medications, or maybe you're on some medications that haven't helped you, I would encourage you to visit the American Society of Clinical Hypnotherapy. They're known as the ASH team. ASH.net. I will put it in the description below, and they will teach you. There are practitioners in your area, I think all across the globe, but I think actually no, it's America. So it's based in the US, but if you are international, I'm sure there's also international societies where you can find a clinical hypnotherapy professional in your area. And, as a disclaimer, I do recommend, if you are going to see somebody for this, see somebody who is already trained in that field. Meaning, if you want to see someone for hot flashes, can you see a menopause practitioner who treats hot flashes, who also does clinical hypnotherapy? Just like myself, I'm a sleep physician, but I'm also trained in clinical hypnotherapy. And I think that works because understanding the whole science and the interactions and really how the brain works is really beneficial versus seeing someone who maybe did a weekend course for clinical hypnosis. Not to say that they can't help people, but sometimes there's a lot of complexities to these type of situations. And just as a plug, if you want to watch the video about snoring, one of my favorite things to say is all the meditation, all the hypnotherapy in the world, as far as I know, won't keep you from won't help you sleep more if you snore, if you have underlying sleep apnea. So that's something definitely to consider. See a healthcare professional that's trained in the area where you need your help. And there's a lot out there that can help. But if you have questions, just email me or put it in the comments. My email is hello@sleephoria.health. And I thank you for watching this video. Hope you have a great rest of your day. Rest well and figure out the best way to help you feel calm, and use some vivid imagery to help you with that. The power of your brain. It's amazing. Goodbye now.